All right, hot flashes in women may not just be a bothersome nuisance. They could actually be a sign of an increased risk for heart disease. Our chief health editor, Dr. Nandi, joins us. All right, Dr. Nandi, let's talk about how hot flashes could potentially raise our risk here. Uh-oh.
Effects on endothelial function. Now, a fancy medical term for the flattened thin cells that line the heart and blood vessels. Now, 272 women were monitored for hot flashes and underwent ultrasounds to evaluate their endothelial function. Now, researchers found women between the ages of 40 and 53 who were experiencing frequent hot flashes may be more linked to have poorer function in those blood vessels.
Let's talk about heart disease, Dr. Nandi. It certainly kills a whole lot of women, we know, the #1 killer of women, and it can in some cases be hard to diagnose, right?
Absolutely. It's a real passion of mine. Heart disease is the #1 killer for women, causing roughly 1 in 4 deaths. It's very difficult to diagnose in early stages. Roughly 70% of women have hot flashes during menopause. Now, this study's findings may help doctors assess menopausal female patients for heart disease risk. But more research is needed to better understand why these hot flashes may actually affect the vascular health.
Yeah, one piece to the puzzle, it seems, though. Let's talk about the prescriptions that you've got for us.
Absolutely. So there's no denying when you're experiencing a hot flash, the intense heat and sweating can be very uncomfortable. So here are ways to manage them with my prescriptions. #1, please don't smoke or give it up. Smoking can increase hot flashes along with your risk for heart disease, stroke, and cancer. Also, meditation or slow deep breathing can provide relief. Try 6 to 8 deep breaths per minute for 15 minutes. That helps you a lot. Keep a journal by your side and note what happened just before a hot flash. You may identify triggers and be able to avoid or minimize hot flashes. And finally, exercise and add movement to your daily life. Women who are sedentary or not moving very much often suffer more with hot flashes.
What about risk factors in general for heart disease? Because there are a lot of them.
Absolutely, Joanne. So risk factors for heart disease include diabetes, poor diet, physical inactivity, too much alcohol, and being overweight or obese. Hot flashes early in life may now be another red flag. It's really a good idea to speak to your doctor about heart disease, screening, and other ways you can manage menopausal symptoms.
Yeah, great advice as always, Dr. Nandi. Thanks for
Joanne.
being with us.